Hi, I'm Jennifer Bellamy. I'm going to be doing my head, neck, and lymph physical assessment. Here, I have my permission to film her in this physical assessment for Georgia Southern. First, for my head, neck, and lymph, I will start out by palpating the scalp. I will look for any obvious bumps, bruises, irregularities, trauma, or problems. I'll pull the hair back and everything looks good with that. Next, I'll palpate the skull. Make sure there are no abnormalities. I will assess the size, the shape, any trauma or bumps, bruises or indentions. Everything seems fine with the skull. Facial expression. I will look at facial expression by cranial nerve number 7. So everything seems to be symmetric on the face. There is no drooping. There are no abnormal facial movements. So everything with cranial nerve number 7 seems to be appropriate. Next, I will palpate the temporal artery. I'll do that by placing my fingers on the temporal lobe and palpating for any bounding pulses or any problems or irregularities, and everything seems good with the temporal artery. Next, I will be palpating the temporomandibular joint. I'll ask the patient to open and close her mouth to assess that joint. Okay, open, close, open, close. Any pain? No. Okay. Next, I will be palpating the maxillary and frontal sinuses to see if there's any pain. All right, maxillary. Any pain when I press there? No. Okay. Frontal sinuses. Any pain when I press? No. Okay. Next, I will be assessing the carotid pulse. I will feel one side at a time, make sure there are no excessive bounding or heart rate issues, and make sure it is regular. Do one side at a time. Carotid pulse. Very regular, no bounding. Next, I will be assessing for a carotid bruit, and I'll do this by asking the patient to hold her breath and assess the 2 areas to which you assess carotid bruits. Do that with the bell. All right, if you could take a deep breath and hold it behind the ear. And on the carotid pulse. Everything sounds nice and even, no problems, no excessive bounding, okay? You can relax. All right, next I will be testing range of motion with the head and neck. I'll do this by asking the patient to perform a series of exercises. Okay, could you look up, down, side, side, and shrug your shoulders. Okay, very good. Next, I will be testing muscle strengthness by asking the patient to do the same series of exercises with resistance. Okay, if you'd look to the left, okay, to the right, look up, okay, down, and shrug your shoulders. All right, that's great. You can relax. Cranial nerve number 11 has to do with muscle strength of the neck and of the shoulders. So next I will be assessing the thyroid. I will also be assessing the neck for the trachea and the midline, but right now for the thyroid, I'll palpate the thyroid and I'll actually look to see if there is any irregularities, swelling, or bumps. There's not. So I will be assessing the thyroid by having the patient drink a sip of water. All right, I want you to take a sip of water and hold it in your mouth. Okay, and swallow. Okay, very good. The thyroid feels very regular, no swelling on either side, and no problems with the thyroid. I will also be looking at the neck for any goiters, lumps, or bruises, and the neck seems like it's good. The trachea is midline. So no problems with any deviation of the trachea. Now I will be doing lymph nodes. I will be palpating each of the lymph nodes, and I'll have the camera zoomed in so you can see where I am palpating the lymph nodes. Okay? All right. Okay. Pre-auricular. Okay. Post-auricular. Right behind the ear. Occipital. Right on the occipital lobe. Everything feels good with that. Okay. Submental. Right under the chin. Submandibular. Jugulodigastric. Superficial cervical, right down the side of the neck. All right, and for deep cervical chain, I'll ask you to turn your head to the side. Okay, that's good. And other side. Okay, and those feel good. And last but not least, I will be doing the posterior cervical. Right behind the neck. Actually, one more is to shrug your shoulders and to feel the supraclavicular, right above the clavicle. Okay, let your shoulders down. All right, everything seems to feel good with the lymph nodes. That will conclude my physical assessment for the head, the neck, and the lymph nodes. Thank you.